One of the fears associated with prostate cancer actually goes all the way to screening and whether you have to get a rectal exam, which obviously is one of the biggest challenges for men. They certainly don't look forward to having a rectal exam. And then on top of that, when we do a prostate biopsy, routinely we do it through the rectum, which is an ultrasound probe that actually goes through the rectum. One of the biggest fears that men have is actually having the rectal probe or having a rectal exam, which I get. You know, it's certainly not a comfortable experience, but it's gotten a lot easier now than it has 10 years ago. So let's talk a little bit about that. So now when we do rectal exams, that's the same. It's not like our fingers have gotten smaller over the last 10 or 15 years, but we're pretty good at actually making sure that we're just not feeling any abnormalities. And it's just, you know, when we talk to women, they routinely say, look, I have to get a pap smear, I get a pelvic exam. So guys, it's just one of those things you do for your health, just to make sure that when you're getting, older, we're just not making sure that there's just nothing bad going on in there. And the second part of it, of course, is actually getting the ultrasound and getting the prostate biopsy done. And this is actually particularly important for men because 5, 10, 15 years ago, we were not particularly good as a field in the urology field in terms of biopsying prostates and minimizing the amount of discomfort for the patients. Now, what has changed in that? Well, the good news is that the ultrasound probes have actually decreased in size, and so the smaller the ultrasound probe, the less uncomfortable it is for the patient, so that's good news. And the second part of it, we've become much better at actually putting anesthesia and numbing up the areas around the prostate. So the better we are at actually numbing up around the prostate, the more comfortable it is for the patient. So routinely the areas of discomfort for the patients is when we actually have the rectal probe in the rectum, which again is no fun, but that's smaller than it was 10, 15 years ago. What I think more importantly, as we talked about, is numbing up around the prostate. So if we're good at doing that, if we can numb up those areas around the prostate, when we actually take those biopsies, which is a small needle that actually goes through the prostate itself and takes a small little snippet out of that, you should basically feel like almost like a little bit of a thump. It's sort of a little thump that goes right up against the prostate. Now in the old days, before we actually weren't particularly good at doing anesthesia, so we didn't know where to put the needles, and more importantly, where you didn't even do any anesthesia at all, you would feel every individual biopsy. So you'd feel this snap that kind of went through. And again, whether you're doing 6 biopsies or 12 or 14 or sometimes even 18 or 24, that was a pretty traumatic experience. There's no doubt about it. But we've come a long way on this, and patients are doing significantly better. I think the big issue is, of course, is that are we good at this? And I would say that we have taken a particular interest to make sure that we're numbing up and anesthetizing the area around the prostate so patients actually don't feel those biopsies. And I think the second thing, of course, is to make sure that we're efficient at doing this. Routinely, it takes us less than 10, 15 minutes on the average to make sure that when we localize a spot that we want to make sure we biopsy that specific location. We do it, we're done, and again, when we go out and that patient walks out, they say, you know what, it really wasn't that bad. And that's our goal. Our goal, certainly at USMB, is to make sure that when patients actually have a biopsy done, they come out and they say, man, I was really dreading that, and even though it's not something I would really request coming back next week for this thing, but I actually felt like it really wasn't that bad, and I feel like, you guys did a great job, and I'm certainly not going to go back to Denny's and tell all my buddies that this was just a miserable experience.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.